Okay. Hello and welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you but help you to move on to the brighter side of the health. In today's video, let's talk about how to hack your pain with Physio Sara Ansari, who is a team member at HealthQ Rehab and a pain specialist, pain management specialist who brings a lot of empathy, lot of emotional well-being, and her mantra of well-being for everyone, and that is to use intuition, to use your internal instincts to deal with your pain. So with me is Dr. Sara. Welcome, Dr. Sara, to this session.
Hi Meghna. Hi everyone.
Hello, how are you doing?
I'm doing very well.
Awesome, awesome. So it's always fun to have you online and have this conversation, deep, insightful conversation. And today's topic is very interesting because I think pain is something which is global problem. It's not something that's just in India; it's everywhere. And I would say, if we look at the global estimates, then around 20 million people only in India are suffering from chronic pain. Now, if that is the scale at which the people are experiencing chronic pain, it needs to be fixed. And there are a lot of issues that are so subtle, so easy to manage, but people just don't know that hacks. But somewhere you have cracked it with working with a lot of patients. So I would like to dive deep into this and understand about these hacks. So to start these all conversation, my first question to you is, what is pain and what are the common myths that people have around pain?
Pain is something. The moment when we hear about the pain, there's something that we imagine or think of something which is negative. Whereas pain is actually our friend. There are idioms, there are movies, there are local dialect, and everywhere pain is used as something which is not good. Like people say, it's a pain to do this work, right?
Right.
However, if we deep dive in and understand what pain actually does, it is something that helps us. It is something that requires a lot of effort, that trains us to understand what is helpful and what is not helpful. So
Right.
taking pain as your friend and empowering yourself to take care of your health is something that we will be talking today, and that's the mission. Yeah.
Awesome, awesome. So let's talk about your personal journey, right? How did you land up with this concept that empathy and intuition can be a great way of dealing with pain? What was those some experiences that you had with working with while working with patients that gave you this understanding?
So I like initially in my career, I had mixed kind of patients. Some were young, some were old, they were children, and I noticed that chronic pain was more common in youngsters,
Mm-hmm.
middle age, or when I used to ask them, on a very informal way, how are they doing, what's happening in their life, I always found that there is something which is impacting their pain. And
Mm-hmm.
that thing is usually we can't test. Your blood test can't tell you, your scans can't tell you, your MRI, X-ray, they can't tell you what is happening in your personal life. And
Mm-hmm.
when we analyze, we understand that these little things are impacting the pain the most. And this was where I really got interested in knowing my patients as a person, but not as a case number. And talking to them, meeting them, sometimes texting them, taking their calls, not just appointment based that I'll see them only when they take appointment, rather than they can talk to me whenever they want. So that kind of process helped me understand that pain is not something physical. Pain is something that is complete person. It's biopsychosocial, where your body, your psychological aspect. And when I say psychological aspect, it doesn't mean your mental. It means that how do you see things, how do you perceive things, how
Yeah.
do people around you perceive things. So it's a lot about your social aspect also. Are you somebody who's very active? Are you somebody who's sedentary? Are you somebody who's surrounded by patients?
Hmm.
surrounded by people who have aches and pain? Or are you
Correct.
surrounded by people who pamper you so much that even a little suffering is, considered as a big trauma? So your social circle also determines the level of your pain. And if these things are impacting your pain, then why not use these things in your treatment? And that is how I came up with exploring more about chronic pain. And my personal experience also made me a better physio, in which I, not chronic pain, but I experienced pain briefly for 2 to 3 months. And when I started taking treatment, I understood that it can't be confined to one session only. It has to be like 24 hours dedicated to something. Yeah.
Right, right. Makes sense. So, I have certain experiences working with patients, and what I see is that patients think that pain is a monster, right? And they consider that as the biggest challenge of their life. And when that mindset kicks in, then
Hmm.
when that pain becomes so big than life itself, then it starts taking over. But if we can change that mindset and start treating pain as a small baby who is just throwing tantrums, and then the human mind and the human brain has the capacity to bring that under control. And if
Hmm.
patient develops that mindset, that belief system, then definitely patient have that ability to take control over pain. I would like to know your thoughts on this.
That's very true. Pain is like a child. Definitely, it's there with you. It comes out of you. So if you see yourself as a parent, then pain is very much part of you. You can't leave it. You don't want to leave it, no matter how notorious the child is. Similarly, pain is a part of you. It will remain with you forever. But it doesn't mean that it will take over your life as a monster. Rather than it is something that you have to train and understand. Like a child, on initial days, let's say initial 6 months, you have to take care of everything. Let's say sleep, let's say feeding, clothing, everything, washing, everything you have to take care. And when the baby grows up, you start with potty training, you start with food and everything. And slowly and gradually the child becomes trained enough to take care of themselves, and they come to you only when there is something which they can't deal themselves. So uh, similarly, if you see your pain, like today, if you've got a pain and this is a new pain, the question is, the pain is trying to say something. Let us talk and understand what the pain is trying to say. Is it indicating that there is an injury, there's a damage? Have I overloaded myself? Sometimes it's not injury, it's not damage. It is just that, you know what, you need rest. So what is this pain trying to tell me? So it involves a lot of, retrospective analysis, where you would talk to your child that what exactly happened in the school. Did you start fighting or somebody else? What was happening around you? If you were the one, picking up the fight first, what exactly happened? What was there in your mind, right? So similarly, when you get the pain, you would actually understand, uh, when you retrospectively think about it, that did I sit a lot? Did I overstress myself? Did I just go for a trek and I was not prepared for that, right? Or maybe I lifted a weight for which I was not trained. I usually lift 10 to 20 kgs, but today I had to lift like 50 kgs, and I have landed up in pain. So your pain is actually something that is indicating you that something is happening in your body. This is the best tool when you see this as an acute pain, right? It's the first pain that you're experiencing. It's severe and it needs attention. Sometimes the pain gets chronic. You know the child is notorious, and your child is the one who picks a fight every time, right? So what do? You will not, slap your child. You will not punish your child, because you know the child is getting stubborn now. So you'll have to be very creative. You'll have to think of ways on how to take control of the child. And when you will actually deep dive in, you will understand that this stubbornness is coming from a behavior or something that the child has experienced in past. And if you try to fix it, then the whole chronic cycle gets disrupted. Like, if you know the child has, let's say something very simple, whenever the child needs something, let's say a toy, they don't tell you they need a toy. they start crying over it. So it
Right.
gets very annoying for you. You don't get a scope to tell the child that you'll buy some other day, right? Or you don't get a scope to just buy it because the child just started throwing tantrums, right?
Mhm.
So what would you do? Why is this happening? Were you being ignorant in past that the child has developed this behavior? That is something what happens with chronic pain. Why did this pain become chronic at first place? And why has this pain got so notorious? Similarly, when you get the pain, you have to think, sit with your diary, sit with your pen and paper, you have your phone, go to the notes, go and WhatsApp yourself that I have got the pain, what new I have done, what all other trends that I have noticed, how it is impacting my let's say work life, my personal life. Like you are in pain and you have a deadline, and with that deadline your system is not working. Now you're getting agitated because the system is not working, it's affecting your work, and that is now overloading you, your body, and the pain level has gone high. This doesn't mean that there is a damage inside the body, rather it means that what we need to fix is the computer. So this is how chronic pain works, and one has to be very creative. You have to be smart. You have to strengthen your intuition and see how you have to take care of this baby that resides inside you, and that's pain, which is always there to help you by giving alert signs.
Right.
Yeah.
Right. Makes sense. Makes sense. So, in general, traditional medical concepts, right, pain is still considered a very mechanical issue, right?
Hmm.
Or else, there is an absolute other categorization where it is categorized as a mental issue, right? But
Hmm.
still, medical science don't consider that it could be an overlapping of two things or three things as well, right?
Hmm.
And again, I would like to know your thoughts. According to you, is it true, or it's always the overlap between two or three components coming together and giving the sign of a pain? What are your thoughts on that?
So there is something called all or null rule. So it's
Right.
black and white. And realizing the fact that we humans, we are very diverse. We are diverse in terms of our geography, our demography, the way we look, the way we eat, the way we talk, everything. So we are diverse. It's a huge continuum. And in that, if we talk about pain science and whether we see it as a psychological issue or we see it as a mechanical or a physical health issue, this can't be black and white. It has to be gray. So pain is gray and it has a lot of scope, and there's a lot that is happening in between. For instance, let's talk about physical manifestation of stress. So when people are stressed, they get a lot of pain in their upper back. And
Right.
how
Right.
do they see it? Upper back pain can be weakness. It can be coming from your cervical spine, from your neck. It can be, let's say, nerve compression. And these are the diagnoses that your physio or your ortho will tell you. Whereas your psychiatrist or your psychologist may tell you that this is stress. But how to understand? Like, suppose if I would have been a patient, now I'm confused whether this is coming from my stress or is this something that has happened inside my shoulders, my upper back, or my neck. So, what actually happens if you observe me? Suppose if I'm talking to somebody and there is something that is stressing me, and I was actually, I started off with a great enthusiasm. I was, tall and sitting comfortably and confident. And now I just realized that, it's not going the way it should go. And slowly my posture is getting slouched. And now I'm sad and upset. And my whole posture goes like this. And because I'm sitting like this now, I don't look smart and confident because I'm literally sitting like this.
Mhm.
And because I don't look smart and confident, a lot of opportunities goes off my hand, which actually increases the problem. Then because I'm sitting like this, my own I don't feel good about myself. So my psychological and my emotional status also goes down. Plus, because I'm sitting in such a bad posture, my muscles are getting strained, which is now resulting in pain. So what do? We need one good news. We need one supportive healthcare provider or a family member or employer, anyone around you who could just help you to be happy and tall again. So what did we actually do? We can say, I have corrected your posture. We can say, okay, no, I have actually, worked with your hormones. Earlier, you had more of sad hormones. Now you have happy hormones. You were depressed, and now you're confident. So the terms we use again can be diverse. But what is happening? You saw that you were not tall one day and slouched the other day. It happened over time, and that's how the correction also takes time. And you have to involve, you have to involve a lot of physical, mental training and lifestyle modification. And when I say lifestyle modification, it is not just buying a good chair, it is also being confident about yourself, right? Having empathy for people around you, because when you are empathetic for people around you, they also pick that up. They also recognize that you're being kind to them, so they be kind to you. So this is how the whole aspect get corrected, and the bridge that we're talking about, the black and white, gets, we get a bridge there, and the whole
Right.
problem gets solved. So
Right.
in one way, like, is this black and white? No, it's gray.
Hmm. Right. That's so nice to hear, and so different concept altogether. I would like to hear some anecdotes if you would love to share with us. Some real life stories or some experiences that you had working with patient utilizing these concepts or using these concepts and your findings on that.
One of the patient that I can think of, she's 31,
Mhm.
and her first episode of pain was like 10 years ago when she was 20, 21, 20 something. And she just came out of school. She took admission in MBBS, very enthusiastic, wanted to become a doctor. She's got doctors in her own family. And um, then she started getting aches and pain. She got very severe back pain. She could never point out what was the reason. There was no accident, no lifting of heavy weights. She was sitting for her studies, but not as much as rest of the people, because she was herself surrounded by healthcare providers. So she was taking care of her physical activity. So she could never point out how did the pain start, but the pain was so vicious that it was taking over her life. She could not think of anything else but her pain. And as the pain got worse, it's with visiting one doctor to the other, uh, she told me she can't count how many doctors and healthcare providers she has been to, including orthos, neuros, Ayurvedas, physios, yoga therapists. Like, she said, you name it, and I have been there. And after all those, she had to undergo a surgery, which was a failed back surgery. Now imagine a young girl in her early 20s having a failed back surgery. She was a medical student herself, surrounded by doctors in her family. Now, if she goes out and meet a friend who's a layman, and that friend tells you, you are a doctor yourself, how did this happen to you? How did your family members let this happen to you when they are doctor themselves? Now, you know what happened when somebody tells you like this? Your problem doubles up.
Yeah.
Now, she's already depressed because of the failed back surgery, not getting her answers. Failed back surgery and chronic pain also means she was not able to sit for longer. She stopped going to gym. Then she stopped going for movies because she can't sit for 3 hours. She stopped going for swimming because she was embarrassed going there. One thing after the other. What was happening in her mind? She was anxious earlier, then she started going into depression. Because she was going into depression, she found a way to make herself happy, and that was to eat something. As a result, she adapted adapted will be the wrong word. She developed a condition in which whenever she felt uneasy, she used to eat. Now, what happened if she eats a lot? Overweight. Now the story is completely changed. Whenever she goes to a doctor, they tell you lose weight. Now that's altogether a different story, a different range of frustration that starts. Where whenever you go anywhere, the doctor tells you lose weight, lose weight, lose weight. But they don't know how to lose weight. I'm not able to control on my eating habits because it's not something in my control. It's happening from my head, and I'm already taking treatment for that. But I don't see any improvement. Then what happens? The physio tells you, I'm not able to do XYZ exercises, which will definitely help you with your back. But I'm not able to do it because you're obese and I'm afraid, and I'm not able to mobilize you. My pressure doesn't go deep in because of the fat layer and so on. I can give you this electromodality, but I'm trying to give it because again, the fat layer is actually it works as an insulator, so it does not allow us to go in for a lot of electrotherapy or the machines that physios use. So it completely became a barrier. Her life was already disrupted, and now something new that has come up, which is called obesity. So with all these things going around, she met a new mental health therapist who told her that, I don't see you as a patient who needs a lot of, psychiatric treatment. You don't need medicines. I see you somebody who needs a psychologist, as in somebody who can help you to understand, track your condition and deal with it, get empowered. And that was also the time when her psychologist tell her that because the problems are so much, you need to have multiple people in your team. So she reached out to me. We reached out to a nutritionist. So we sat there as a team. She had somebody to take care of what she eats. She had somebody to take care of her mood. She had somebody to take care of her exercise. So when we started seeing her as a team, miracles start happening. And now, if you ask me how is she doing now, she can sit for 12 hours in one go. She had a flight, and she told me she got up just once for washroom. So that is her capacity now. But this did not happen in a day or two. What was the best thing in her is that she was very patient, very patient. And every time she would talk to me, because of the empathy she carries with her, she would always tell me that, I'm sorry, I know I have told you this many times, but I'm still asking this question. So when I saw her being so kind to me as a therapist, why would somebody be kind to their healthcare provider? It's
Right.
we who are supposed to be kind to them. But then she
Right.
was being kind to me. She was being very generous, very polite. And when I had to explain her things and I used to talk hours, she would say that, why don't you take some water? I think you must be thirsty. And that changed me, and that changed her, because now I was also being very kind to her. I was more considerate to her. So we may or may not realize the empathy that she holds in her was actually helping her a lot.
Hmm.
With that, as a team, we got her better, and now she is somebody who can take care of herself. She still gets pain. If you have a question, she's pain free completely? No, she's not pain free completely. She still gets pain, but how often does she get pain? 2 to 3 times a year. And how long does the pain stays there? For 2 to 3 hours. So if you get paid 2 to 3 times in a year for 2 to 3 hours only, and if you compare it, it's as normal as anyone else. And
Right.
remember, we need pain because the pain tells you you're getting infection inside. The pain tells you there's fracture inside. The pain tells you that you are overloaded, overstressed. So we need that pain. We don't want to shut down that alarm from our body. We need that pain. But we don't want the pain to overtake. We don't want the pain to dominate us. Similarly, as we talk about the child, we don't want the child to get notorious. We want the child to be around us. We want the child to be independent. Similarly, we need to train our pain. We have to hack the whole system and understand how does it work. And
Right.
along with a lot of physiotherapy and other treatment, whatever is recommended in your case, what is required the most is to develop empathy. Yeah.
Right. That makes so sense. So I think the moral of the story is that pain can be hacked. All we need is the right ecosystem of people around you, and someone who is non-judgmental, and at the
Yes.
same time someone who is empathetic enough to understand the individual, not only from one end, from both the ends, because pain management somewhere is a mutual collaborative effort. It is not just one thing. And that takes me to the next question. There's a concept which is said that motion brings emotion, right? Also, if you don't move it, you lose it, or else if you don't use it, you lose it, right? Now this applies not only to neurons in the brain in the concept of neuroplasticity, but it also equally applies to your muscles. It equally applies to your blood vessels, or no matter any cells in the body, right? Now the biggest problem people think with pain is that if pain comes, I need to rest. Now, when they think of rest, they think of bed rest, like not moving at all, right? And this is so contradictory to the fact that if you have pain and if you stop moving, it is going to impact negatively to your pain at the same time to your movement, right? So how an individual can hack this all mobility restriction factors to overcome their pain as well.
So this actually reminds me of something that happened few days ago. Um, I was not at home, and when I came back after few months, I realized my mixer grinder was not working, and it was not working just because it was kept there for so long, and there was nothing but dust particle inside. So it was not working because there was absolutely no motion, which led to sedimentation of lots of dust particles, which led to
Right.
jamming of the machine, and it was not working. So we
Right.
tried using it, it didn't work. Again we tried using it, it didn't work. What actually worked was open it and clean it with a brush. Something very simple. You don't even have to talk to a professional to fix it, right?
Yeah.
So I think our body works in a similar way, with add-on emotions in it. If you read the history of humankind, we were hunters. We were somebody who would go from one place to other place looking for food, and the whole life was revolving around the food. Then we started farming and everything, and the whole journey was a lot of physical activity. And with this physical activity there was a motive. Back then the motive was to find food. If you find food, you can feed your people. If you are able to get a huge proportion of food every time you go out, you are considered brave, and they make you your leader. Now when you become your leader, when you become leader of your community, that gives you a sense of responsibility. And when you're responsible, you have to take care of yourself, to take care of others, right? So
Right.
similarly, whenever we experience pain, we again go into a lot of thinking error. So thinking is something that we need to work. For all the chronic pain patients, the first thing they have to do is actually identify what are the thinking patterns they have. Is this a thinking error, or is this a genuine response that anybody will do? So one of the common thinking errors is fear avoidance, all or null rule. Like I have pain, I have to go to the bed, right? It's I do it or I don't do it. There's nothing in between, right? So if you have pain, this means you have to slow down, and then after slowing down, as soon as you feel better, go back to your routine. What do we usually do? We go to bed, right? So that is again all or null. So we don't want that. We don't want black and white. We want something in between. So if there is any pain, close your eyes, just scan your body. Just feel one part of the body at a time and see where are you feeling, what are you feeling. Is it actually pain, or do you feel stretch? Do you feel heaviness? Do you feel tired? What exactly are you feeling? Other than the pain that you have analyzed, do you feel anything else also? Do you feel you're thirsty? You haven't have water, you have not hydrated yourself properly? Or along with the pain that you have scanned, do you feel hungry as well? Or is there something that is stressing you? Are you emotional about something that has happened in past, right? So when you scan, especially in case of chronic pain, you'll be surprised to know that your pain will never come alone. It will come with a plus one. It will always come with a friend. Sometimes it's hunger, sometimes it's thirst, sometimes something emotional that is going on in your mind. And most of the time this emotion is either a sense of uh, helplessness, where you have self pity, you feel bad about yourself, or it comes with anger issues where you're irritated, you're agitated, you're annoyed about something that has happened. So as soon as you see that the pain has come with a friend, this means the treatment, it has to be with something else, right? So bridging the gap, number one. Number
Right.
two, strengthen your intuitions. You need
Right.
to scan and see what is happening, where it is happening, what it is happening,
Right.
and
Right.
that's how you can tackle it, right?
Hmm.
Movement or no movement. So it's never movement or no movement until you have fracture.
Right.
You have a fracture. Your scan says it's a fracture. Your doctor has put you in a cast.
Hmm.
That is the time you don't move that particular joint or bone. You're still allowed to move other part of the body, right?
Right. Right.
It's always something in between.
Hmm.
And this starts with scanning, strengthening your intuitions, right? And recognizing your thinking patterns. And it's not very difficult to recognize your thinking pattern. You can just go to Google and see what are all other thinking patterns. There are 8 to 10 thinking patterns as per different publications, and see where do you stand. And
Right.
every time you get a feeling that you are getting pain or you might get pain, right?
Hmm.
Ask yourself, is this a fear avoidance? The pain is not there, but I'm stressing for something which may happen, which has not even happened. So this
Right.
means there's a fear avoidance. You don't want to do something because you're afraid, right?
Right. Right.
The solution is simple. Try it and see what is happening, right? It can be all or none rule.
Correct.
It can be a behavior completely led by emotions,
Hmm.
right? And then there are many more. So correct your thinking errors to
Right.
hack your brain.
Got it. Got it. That takes me to the very important question, like, what are the 5 simple hacks anyone at home can start implementing to reduce their chronic pain?
So like if you have a pen and paper, just write it down. So as soon as you get any pain, close your eyes and scan your body. And when you scan, start from one end. Like close your eyes and feel your toes. Are your toes fine? Do you feel anything? Then go to your foot, then your calf, then your knee, your thigh, your hip, your spine. Go up, 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 and then your hands, your head, everything. Scan one at a time, and
Right.
keep on writing what unusual you feel, what
Hmm.
unpleasant feeling do you have. It doesn't have to be just pain. It has to be anything else that you feel. Maybe you're not sitting properly, and when you sit properly, the pressure that you were feeling on one hip has gone now,
Hmm.
right? So you have corrected something. So scan, number one.
Hmm.
Number two, after documenting it, after writing it, okay,
Hmm.
see if it has come with a friend.
Hmm.
Okay, what else are you feeling mentally with that? How's your digestive system going on? Did you sleep enough?
Hmm.
Ask yourself all these questions to validate that pain. That is this my pain? Is my pain true or not?
Hmm.
Uh, Ask yourself, am I getting pain because I didn't sleep well? Am I getting pain because something happened and it's bothering me? Is it because you did not eat well? You have poor digestion? You have acidity or anything else? And if you feel that it has not come with a friend, your pain is there. It's there alone, and nothing else you feel, and everything else is fine. Then again ask yourself, if my pain is so severe,
Hmm.
did something happen? Like, did I fell off? Did I sit a lot? Did I lift anything? Ask yourself these questions.
Right.
If you get the answers, you can fix it, right? Suppose you got the answer that you sat for longer. Okay,
Hmm.
again ask yourself that,
Hmm.
did I really sit long, or is it I'm assuming that sitting always gives me pain, so sitting must be the culprit again. Okay,
Hmm. Hmm.
sitting is a fundamental position.
Hmm.
Sitting is good. Do not take it as something which you don't have to do. Rather, you have to train yourself to sit. So tell yourself things like this. That
Hmm.
it's, I haven't done any crime. Be kind to you. Be empathic towards you. And after all these analysis, asking yourself the right questions.
Hmm.
Ask yourself, just print out the thinking errors and see if you are falling in any of the category.
Hmm.
After these analysis, then see what your next behavior should be. Your
Hmm.
behavior should be to cry out of pain. It should
Hmm.
be to seek help. If it
Hmm.
is to seek help, where are you seeking help? Are you talking about your pain with your friends and family
Hmm.
too much? Are you discussing your pain too much? Because that also creates problems. Because
Hmm.
you get advices and reaction from others which may or may not be correct for you and your situation, and it may worsen your condition. It may stress you more. So
Right.
if you feel that it is something that needs to be addressed, who are you going to talk to? Talk to a family member or friend who you think is kind to you, right? Or somebody who's non-judgmental.
Hmm.
If that helps, well and good. If not, go to a healthcare provider who's ready to listen to you.
Hmm.
Right? So
Correct.
then, when the healthcare provider gives you a solution, have that discussion. Do not just bring the script and then go to a chemist and buy the medicines or do the exercise. You need to have that discussion. Tell that I'm not able to do it. Yeah, I am able to do it, right? Or I would love to do it, but not now. I'm busy. Whatever challenges you have, do tell them so that they can think of more creative ways to get you on the treatment track, right? After all these things, trust the process. You have already worked on your intuitions. You have already scanned that whether you're thinking correct or not, whether your analysis is correct or not. You have taken some support from your friends and family. You have spoken to a healthcare provider also. You have a plan now. Trust the process, stick to it. And if it is not working, there's nothing to be stressed out. You have to go back to your healthcare provider, bug them, tell them that no, this is not helping, this is also not helping, this is also not helping.
Right.
Bug them. Do not give up. Do not
Correct.
give up. If you have a good coordination with your healthcare provider, stick to them. Do not run from one therapist to the other because that further leads to confusion unless you are 100% convinced that, I have valid reasons to go to other healthcare provider.
Right.
So it
Right.
actually saves you from, emotional wastage. It saves you from a lot of time wastage. It actually saves you from a lot of financial burden that will fall on you because of chronic pain. And when things starts getting better, you will notice that everything around you gets better.
Right, right. That's so true, and I think that's the key as well. So any problem definitely has a solution. The solution cannot be straightforward always. It needs to be figured out, and it takes time. So that requires patience and a lot of work with other professionals who can help you out. And having said that, I would love you to talk to people about your program that you're working with us in collaboration on Hack Your Pain. Just a quick shout out, if you would love to give to our audience, like how we're going to work on their pain with our method.
So, to the listeners here, number one, I understand pain. Pain can be something very annoying. It is something very depressing. And whenever you are in pain, you feel everyone is selling you something. And that is, that is actually something that pulls you further behind. So what you have to do is do your own research and see where your heart agrees. And if you're listening to me today, and if at all you feel that you would want to talk to me in person, and you want to understand how I can help you in your condition, how help you rehab, because I'm saying help you rehab because we work as a team. If you need a yoga therapist, if you need somebody else, then we know that we are there as a team. We don't have to refer you here and there or refer you out. So talk to us, book a consultation, and let us see what we can do for you and how we can get you better together as a team. So it's no way that I'm therapist and I'll get you better. It's always like we have to solve this problem together. We have to get this sorted, and
Right.
know that it needs time and patience because. you are suffering from pain and you know that it's not that easy. You have tried many things. You have been in this for a while now. So a reversal of this condition will also take time. So if you give me 2 to 3 months, some people even go up to 6 months because the process is very lengthy. They see a change, and this 3 to 6 months is actually an investment. It's like studies. You study 3 to 4 years and then you become something and you earn rest of your life. So similarly, with those 2 to 3 years of studies, you become established professional. Similarly, when you give 2 to 3 years to your pain, sorry, months to your pain, and we get you better together as a team. You know, working on your sleep cycle, your physical activity, your mental health, everything around you. So you see that in this investment has helped you, and now your aches and pain, it's your friend now. It's not working like a monster. It's not climbing over you. So yeah, I would love to talk to you guys. Please drop in comments if you have to say anything so that I can read your comments, and me and Meghna can plan something for you. If you want to talk to me in person, if you want more privacy, then book a consultation with me. Yeah, I would love to talk to you all.
And on that note, I would like to make an announcement here, guys. We are opening up free discovery calls only for viewers of this video. So, in the description box, there will be a link available for you. And clicking on that link, you can book a free 15 minutes of discovery call with our team members who would be able to guide you which is the problem that needs to be solved and how it can be solved with our collaboration. So make sure to hit on that link and reach out to us, and let's solve your pain problem together. On that note, we'll end this video here and we'll see you in another video. Thank you.
Thank you guys. Bye bye. Thank you, Meghna.